Medicine Forward was founded in 2020 by a handful of physicians, Eric Topol, Emily Silverman, Esther Chu, Brian Dixon, to name a few, and has had just some wonderful endeavors over the years. But in the last year, we've really gained some steam here. We've got about 400 members currently, and it's not just physicians. It is a bunch of like-minded, positive change agents that are assembling to cause quote unquote good trouble. Currently, I serve as the Chief Impact Officer. I joke in many circles that makes me the chief troublemaker, probably because I like to stretch boundaries, ask questions, and challenge the status quo. And that's what we're up to within Medicine Forward. And if you go back to the origin of Medicine Forward, it's really to restore the doctor-patient relationship, that sacred bond that has been eroded over the years, which can be extremely powerful, especially when it's done well both ways, in fact. So we're moving beyond that, though. We're at a pivotal time with Medicine Forward where the inclusivity is becoming a key part of this. We realize that physicians can't accomplish all these changes on their own. And even in our core attraction team, it's about a 50-50 split of physicians and non-physicians. And to me, that's amazing. And I think that speaks to the power that is possible with one-to-one, so to speak, of the physician and the non-physician coming together for change. So that's really our purpose. Long-term, we're hoping to not only organize these change leaders, but accelerate the transformation. Gabe Charbonneau, who's one of the co-founders, he talks about a federation of change leaders. And that's really our vision long-term, is to organize and assemble those key individuals who want to make change going forward. So what's our vision? We like to see our effort as a grassroots or ground up change, get that groundswell to not just talking about the problems, but actually moving towards action. I like to say that we are hopefully a magnet for positive disruptors. Key word in there is positive, because you can cause disruption, but if you're not moving in a positive way, you're probably actually creating more problems than solutions, if you will. Again, I talked about inclusivity, and I think the importance there is really the power of the collective. You know, there's only 1 million physicians plus or minus in the United States, but we have 330 million people in this country, of which the vast majority of them have some level of frustration with the current delivery of healthcare. If we can organize those voices and project those in certain directions, we are going to be very noisy and facilitate a lot of change. So amplification is definitely key. We vision that Medicine Forward isn't going to be the one making all these changes, but in conjunction with what Lonnie and Denise are doing with the Healthcare Reinvention Collaborative, we can connect individuals, right? We can start to get away from the silos that exist, even with the people trying to facilitate change. It's how do we connect those dots? How do we get John and Kathleen and Lonnie and Paul and everybody else on the same page, so that when an initiative pops up, we can accelerate that. We want to be a part of a network of networks, which is why we are thrilled with what Denise and Lonnie are doing with the Healthcare Reinvention Collaborative. It will streamline the opportunity to spread the word about initiatives such as Prescribe Hope. Perhaps people don't want to work on PBM legislation. Perhaps people want to work on prior auth legislation. I'm just one person, but if I can connect the right individuals, if I can connect Paul with the right person, or I'm looking at Deborah up in my window with the right group to get things started, this is how we can make change. So for Medicine Forward, we build on a foundation of well-being and trust, so critical, so often missing in our healthcare space. We stand up for authentic human relationships. We put humanistic patient care first. Enough said there. Not only do we bring physicians together, but I see us bringing a whole host of positive change agents together, which leads to we claim our power as change agents. Instead of having that learned helplessness together, if we band together correctly, we absolutely can and will be a powerful force. I believe that 100%. And we speak up for health equity. I was just on a call with a young lady in New York City who is doing mental health treatment, and she was lamenting on the struggles that they had. And immediately my mind went to the Healthcare Reinvention Collaborative. It went to Medicine Forward. How can we bring individuals like that into the fold to find other institutions that are having success in the areas that she's struggling and help her out with that instead of reinventing the wheel? Confront challenges with curiosity and innovation. This is a no-brainer to me. We have to think outside of the box. What is going on currently in so many institutions and areas is not working well. We have to think differently. We have to be unafraid to challenge the status quo. I want to impart this to everybody. I'm doing what I'm doing because I'm sick of the frustrations of my colleagues and patients. And I believe that Medicine Forward and what Denise and Lonnie are doing with the Healthcare Reinvention Collaborative offers hope. And if we get nothing else out of this conversation today, it needs to be hope. Because if we can provide hope to one other person, we can create a ripple effect. And the next thing you know, we've started to move the needle.
And Gabe, I see you just dropped that image of the mission for Medicine Forward, which is to stand up for what is sacred in medicine, our relationships with our patients. Thank you for sharing that.
Awesome. I'm so excited to see so many people here that are just motivated to have these kinds of talks and interactions. My closing is that, like, what I feel we need is a shared dream, and we're getting closer to that point, but we're not there yet. And I dropped a link in the chat to one of my favorite thinkers, Donella Meadows. She's kind of one of the god founders of systems thinking, and I think for system transformation, incredibly important figure. And this outlines leverage points where you can intervene in a system for change. And the most powerful place is paradigm, which is like kind of the overriding consciousness that the system comes from. So I challenge all of us to think about what is that shared dream that we can come up with, because it's not whether healthcare is a right or a privilege. Like, we don't even all agree about that. It's not about Medicare for all or not. That's not what the shared dream is. But there is a shared dream somewhere in these conversations. And if we can figure out what that is and turn it into a social movement, that is going to be powerful. So that's, I guess, where I want to leave it.